The GQ-GPCR pathway, again, classically associated with the alpha-1 receptors, right? So GQ is primarily going to be from alpha-1, or if we're talking about parasympathetics, it would be M1 or M3. And I'll talk about all of this in the pharm lectures. But the concept is that these would all lead to some form of contraction. Okay, so this is all associated with contractility. And typically, we're talking about vascular smooth muscle constriction. Now, you can also see alpha-1 receptors in the pupil, right, mydriasis, and at the internal urethral sphincter. Now, the big point here is if we have contractions on arterioles, that increases the total peripheral resistance and the afterload. And we talked about this already in the last videos, so I'm not going to talk about it too much here, but the veins, if I constrict the veins, that's going to increase my preload. It's going to shunt blood back up to the heart. And if I constrict the arterioles, that increases the afterload. That's going to have pretty big effects when we're talking about different drugs. Okay, and I'll talk about that in a moment. So again, the GQ protein is going to increase phospholipase C. Now, phospholipase C is basically, think of it like as a big chef's knife. It's going to cut this guy, PIP2, into two different products. The first one is inositol triphosphate. This is the product that's going to go to the sarcoplasmic reticulum, knock on the door and say, hey, calcium, come on out. It's going to open up the calcium channels at the sarcoplasmic reticulum. The diacylglycerol is actually going to allow calcium to come in from the outside. So again, we have some action potential that comes in, like we just talked about. Okay, action potential comes in. L-type calcium channel is going to open. It's going to allow calcium in the cell. Okay, so my calcium levels will go up initially. And then inside of the cell, there's going to be a sarcoplasmic reticulum. We'll just put SR. Now, once this calcium comes in, it can actually allow more calcium to come out of the sarcoplasmic reticulum. Remember, calcium-induced calcium release. But what we're talking about here is if on the surface of the cell, let's say we have an alpha-1 receptor, and this is going to be a GPCR protein, right, 7-transmembrane protein, and the GQ protein is eventually going to lead to the formation downstream of diacylglycerol, which is going to allow calcium to come in from the extracellular space, and it does this through the use of protein kinase C. Okay, so remember, and just a side note, right, we have protein kinase G, which we talked about with cGMP. Protein kinase A is going to be associated with cAMP, and then protein kinase C, you can remember, is associated with contractility, if that's one way to remember it, or you can remember it's associated with calcium, right? Either one. And this is all with the GQ protein. Unfortunately, the Q and the C don't go together. Otherwise, it would be perfect. So the diacylglycerol and the protein kinase C will allow calcium to come in from the extracellular space. Okay, and then the IP3 is going to be down here, right? The IP3 is going to allow calcium to come in from the sarcoplasmic reticulum. So the GQ protein process is essentially potentiating this contraction by allowing even more calcium to come in. Okay, and alpha-1 is a very classic receptor that's associated with the GQ pathway.